Yeah, so this is one study that was already presented some years ago at EHA. So this is a study that has a combination that is evaluated in a phase 1, phase 2 study. Evaluates the combination of talquetamab plus daratumumab. So 67 patients, I believe, were included. So this is a population of patients with at least 3 prior lines of therapy. The majority of the patients were triple class exposed. Notably, over 50% of the patients were also exposed to prior BCMA therapies, and it could be prior CAR-T or prior antibody drug conjugates, and also prior bispecific antibodies. So the patients received talquetamab. 2 doses were evaluated, and in combination with the standard doses of daratumumab. And in this updated follow-up, what we see is that the responses are quite remarkable. So with a higher response rate, if we can compare to the monotherapy studies, with also a big proportion of patients achieving VGPR or better responses. So really a very interesting data. And I think that what I was more interested about, let's say the number that I liked it the most was the median progression-free survival, that in the group using 0.8 every other week, that is also the group with a larger number of patients, the median progression-free survival was 19.4 months, with a 12 months progression-free survival of 67.4%. So really very, I would say, encouraging data, particularly in this very advanced myeloma population with a median of around 5 prior lines of therapy, and as I mentioned before, a huge proportion of patients with prior BCMA. So for me, this can be that combination that may overcome, let's say, the resistance to bispecifics in monotherapy. I think that this is very interesting data that for sure we need to wait for a larger data set of patients and more follow-up, but still. Importantly as well, the safety profile was consistent to that of talquetamab and daratumumab. No higher incidence of infections or higher percentage of patients with severe infections, and overall the discontinuation rate was very low.